Good morning, dear students. Myself, Dr. Sandeep Dubey, Reader, Department of Conservative Dentistry and Endodontics. Today, we will discuss about rationale of endodontics in this lecture. The word rational means fundamental reason or logical basis. The word endodontics is combination of two Greek words, endo and odont, where endo means inside and odont means tooth. Rationale of endodontic therapy is based on the belief that a natural tooth functions more efficiently and comfortably than a bridge, partial denture, or a metal implant. It is that branch of dentistry that is concerned with the morphology, physiology, and pathology of the human dental pulp and periradicular tissues. Its study and practice encompass the basic clinical sciences, including biology of the normal pulp, the etiology, diagnosis, prevention, and treatment of diseases and injuries of the pulp, and associated periradicular conditions. Now, etiology of endodontic diseases. It can be due to physical agents, chemical agents, and microbiological agents. The physical agents consist of heat generated during cavity preparation of the tooth. Chemical agents can be due to dental cements, which have high acidic pH, which can be zinc phosphate, and microbial agents such as microorganisms, Streptococcus mutans, etc. Although chemical and physical factors can induce periradicular inflammation, a large body of scientific evidence indicates that endodontic infection is essential for progression and perpetuation of different forms of pulpal and periapical diseases. Endodontic infection develop in root canals devoid of host defenses, either as a consequence of pulp necrosis, which can be due to caries, trauma, periodontal diseases, or iatrogenic operative procedures, or pulpal removal of for treatment. Bacteria are the major microorganisms implicated in the pathogenesis of endodontic diseases. In advanced stages of the endodontic infections, bacterial organizations resembling biofilms can be adhered to the canal walls. When bacteria encounter the host defense system, inflammatory changes take place in the periradicular tissues and give rise to the development of apical periodontitis. Depending upon several bacterial and host related factors, endodontic infections can lead to acute or chronic apical periodontitis. These changes depends on the intensity of the disease, duration of the disease, pathogenicity of the bacteria, and defense mechanism of the host. In this flowchart, we can understand the rationale of endodontic therapy in a avascular non-vital pulp which has no defense. Firstly, there is autolysis of damaged tissue which can be caused by the bacteria, which causes breakdown products which can lead into the periapical tissue and cause its irritation. To avoid this, we can do root canal therapy, which can three-dimensionally seal the apical portion of the root canal. To achieve this objective, we can go for non-surgical endodontic therapy, where we can do access preparation, then shaping and cleaning of the canal, and then finally obturation of the root canal. If this does not work, then we can go for non-surgical endodontic therapy to achieve a fluid-tight seal. Now coming on to the theories of spread of infection. Theory was given by Dr. W. E. Fish in 1939, which is the most popular theory. This consists of four zones of reaction. First one is zone of necrosis or infection, zone of contamination, zone of irritation, and fourth one is zone of stimulation. Necrosis is present in the center of the lesion, which consists of microorganisms, mainly which are polymorphonuclear leukocytes. The second zone, which is zone of contamination, is characterized by round cells of infiltration. It causes cellular destruction from the toxins discharged from the central zone, and bone cells and are dead and might go under an autolysis, which results in empty appearance of lacunae. The third zone, which is zone of irritation, it's characterized by macrophages and osteoclasts. Small round cells, normal bone cells can be seen. Collagen framework is digested by phagocytic cells, that is macrophages, while osteoclasts attack the bone tissues. Fourth zone is zone of stimulation, which is characterized by fibroblast and osteoblast. It is at the periphery and toxin is mild enough to be stimulant. Response to this stimulation, collagen fibers get laid down by fibroblast, which act both as a wall of defense around the zone of irritation and as a scaffolding on which the osteoblast built new bone. According to his concept, periapical lesion is not an infection by itself but the reaction of body to infection in the canal. This theory became the basis for successful root canal treatment. Fish theorized that removal of the nidus of infection would lead to resolution of the infection. Now the second theory is Kronfeld's mountain pass theory, which explains that the granuloma does not provide a favorable environment for the survival of the bacteria. According to this theory, there can be three zones: Zone A, Zone B, and Zone C. Now in Zone A, uh, Kronfeld compared the bacteria in the infected root canal with the invaders entrenched behind high and inaccessible mountain paths. In the Zone B, the exudative and granulomatous tissue of the granuloma represents a mobilized army defending the plains, which is periapex, from the invaders that can be bacteria. When a few microbes enter the periapex, they are destroyed by polymorphonuclears. But when the microbes are more in number or more virulent, they have more power, the defensive mechanism, and results in lesions. In Zone C, complete elimination of the invaders from their mountainous entrenchment will eliminate the need of a defense forces in the plains. Once this is accomplished, the defending army of leukocytes withdraws. The local destruction created by the battle is repaired by granulation tissue and the environment returns to normal. So we can conclude, when the root canal has been treated, the reservoir of bacteria or noxious products gets eliminated. When the root canal is cleaned and obturated, the destroyed periapical bone will undergo repair. The ultimate goal of endodontic treatment is either to prevent the development of endodontic lesions or, in cases where it is present, to create adequate conditions for tissue healing.